currently the chair of ESMO Women for Oncology. She is also a member of the ESMO Council. She was the founding member of Hellas, which is in Greece. And
for many, many years in the hospital where I'm working, in my department, being the second in charge for a very long time, even though I had spent almost 10 years of my life studying abroad, even though I was one of 3 people in Greece that had a PhD in oncology from Imperial College, I was still number 2 for almost 12 years in my hospital, until one day I said I have to be number 1. And
this woman is incredible. What she is most proud of, she was telling me, is that she's a global oncology advocate. And if you follow her on LinkedIn, like I did, and that's how I got to know her, it was really what she is sort of doing to really support oncology across the globe and address health inequalities. But
there remains a vital need for more health leadership by women around the world. My talk today is really about empowering women to drive change in cancer care. We're going to have seen a change where, we'll see more women leaders. Like I said, healthcare, 70% of healthcare is delivered by women, yet we don't see women in positions of leadership. So I'm hoping
our final speaker, building on this clinical leadership and ability to influence, is Penny. He's already achieved so much. An oncology leader with integrity. She is an oncologist who wants to deliver for patients and families.
One of my passions is leadership and how leadership can lead to innovation and change. Tonight, I want to talk about psychological safety. And when I started to get more senior leader positions, so consultant and then clinical director and then later medical director, what I observed is numerous power dynamics within organizations and healthcare systems, and lots of politics, and often navigating those power dynamics and politics was quite difficult. What I observed was that women were not very good advocates for themselves. And also, if we are advocating, we are often accused as being aggressive. But what we are assertive and we are confident.
I'm very pleased that I can introduce our first speaker, who is Dr. Sandi Dheensa. She is a research fellow at Bristol Medical School and has done incredible work on raising awareness of domestic abuse in cancer patients and working to ensure that there is a safe space for everyone in the cancer setting.
My research since 2018 has been on the intersection of trauma, violence and health. More specifically, the healthcare response to domestic abuse and sexual violence. We want people to feel safe, we want people to have time, we want the healthcare professionals to feel competent and skilled. For you as Women for Oncology, I'll talk about training, developing training later in the presentation, but I hope I inspire you to think about developing training in your local settings about domestic abuse, to do research into the cancer and domestic abuse intersection, which is particularly relevant for women because domestic abuse does disproportionately affect women, and to also sow the seeds for future collaboration. So I'm a researcher.
My name is Dr. Olubukola Ayodele. I am a consultant medical oncologist who works in Leicester. Initiatives such as WFOUK, it's a movement. It's a platform that helps to change the culture of underrepresentation in leadership positions in oncology. It's a platform that helps to challenge the status quo. We're not doing this just for us. We're doing it for the generation to come. WFOUK provides visibility, mentorship, and community. Success to me isn't about titles or accolades, it's about impact. My biggest advice, know your why, because it will guide every decision that you make, especially when the path gets tough. Stay authentic. It's okay to say no if it doesn't align to your values. It's important to build a network, not just for career moves, but for encouragement, for growth, and for accountability. It's also important to lift as you climb. Create a space for others, especially those that are struggling. Leadership isn't about the loudest in the room, it's about those who listen, support, and pave the path for others. I'll tell my younger self, you don't have to be perfect to be powerful. Your voice matters even if it shakes. Don't wait until you feel ready to lead, because you would always get a seat at the table, but that's okay. You can create yours. I would say take up space. It's okay to be ambitious. Also, remember to rest. It's not a weakness, it is wisdom. I would like to say a big thank you to WFOUK for creating a space to be seen, to be heard, and to be empowered. To all the women in oncology, you are not alone. Your voice, your strength, and your leadership matters.
My name's Mags Watson. I'm Professor of Health Services Research with Strathclyde University in Glasgow. I'm a registered pharmacist, and I also run my own consultancy, Watson Research and Training Limited, and it's through the consultancy that I published this book last year, Women in Academia Achieving Our Potential, and my answers are based on the contents of this book. They're really important because they provide a network for women to share learning and develop collaborations, achieve support, and to grow social capital. And social capital is really important with career success. Try to develop your support crew, and by that I mean people in your life who can coach or mentor you formally or informally, share their wisdom, help you to find the answers to the questions and challenges that you have. If you have a role model that looks or sounds like you, then that's terrific, and if you don't, maybe you could be a role model for somebody else. Having somebody who champions you or sponsors you, again, is really helpful. We don't always know these people exist. And again, you could be a champion or sponsor for somebody coming behind. Other things that are really important is grow your relationships with individuals and organisations that are important to your role. So this development of your network, your relationships is really important. You don't need to be an extrovert to do it, I can assure you of that. Be proactive, so don't wait for 100% of your ducks to be in a row. Take a leap of faith when there's 70 or 80% in a row, and you might surprise yourself where you get. The piece of advice I'd give my younger self is to realise really early on, you don't have to do it all on your own. It's okay to ask for help, and people like helping. So we all stand on the shoulders of giants. I hope this has been useful. I'd like to wish you luck. If you want to cover any more of the topics I've mentioned in detail, they're available in this book. Thank you very much.
The field of oncology is definitely demanding, both clinically, emotionally and academically. Programmes like Women for Oncology UK provide a platform to advocate for equity, challenge systemic barriers and ensure that future generations of women oncologists don't just survive but thrive. If I had to share a few tips for success, I'd say, first, surround yourself with people who inspire and challenge you. Second, ask for what you need, whether it's mentorship, support, or different opportunities. And third, don't underestimate the value of your voice. We really need diversity in opinions and skills if we're going to solve the difficult challenges of cancer control around the world. If I could give my younger self a bit of advice, it would be trust your instincts. You don't need to fit a mould to make a difference. The things that make you different now might be your greatest strengths later. And the other thing is that, of course, hard work always pays off.